Well, after my discussion of these definitions of health and illness, as well as disease and the sickness, then a question naturally arises. Uh, what does a study of health and illness have to do with sociologists, or to be very specific, medical sociologists, right? So here, uh, I'm going to show some discussion on the website of Center for Disease Control and Prevention, right? So it gets into a little bit of social determinants of health and what medical sociologists study. Uh, Not only do we study the phenomena of health and illness, uh, we also study the social organization of healthcare delivery and differential access to medical resources. So here we can see a graph about proportion contributing to each major component of determinants of population health, right? Here we can see, for societal characteristics, right? Some parts here attributable to that component. Then we have total ecology, right? And gene only accounts for a small proportion of population health, right? Okay. Right, that clay kind of gray color, right? And health, behavior, lifestyle, looks like probably just shy, a little bit shy of 25%, right? Then we have medical care. It's arguable, different studies, different research provides different statistics. Here is basically a graph from web page of Center for Disease Control and Prevention. Here is a graph from a article published by one of the most prominent public health scholar, as well as physician professor teaching at the University of California at San Francisco, Stephen Schroeder, right? Article is titled "We Can Do Better Improving the Health of American People," published in 2007 at the most prestigious journal of medicine, as well as in Science General, the New England Journal of Medicine. And in this graph about proportional contribution to premature death, shows that social circumstances accounts for 15% of premature death. Genetic predisposition, 30%, right? Environmental exposure, 5%. Healthcare, 10%. Behavioral pattern, 40%. So in general, non-genetic factors, so social, psychological, behavioral factors, which sociologists and medical sociologists, to be very specific, study about health and illness account for 70%. So that's the reason why we have this very large section in sociology, medical sociology now ranks number 3 of all, in terms of size of all sections in sociology. It is because 70% in here, according to this graph, 70% of premature death is attributable to non-genetic, non-biological factors. Okay. Also continue, and according to another medical scholar, medical sociologist, Bernice Pascalito, teaching at Indiana University, that cutting-edge science suggests that 90% of diseases do not follow simple genetic rules of inheritance. So for 90% of diseases, at least the causes are attributable to some degree social, ecological, behavioral, and psychological factors, as opposed to simple genetic predisposition. And according to World Health Organization, research shows that the social determinants can be more important than healthcare or lifestyle choices in influencing health. For example, numerous studies suggest that SDH, here, SDH mainly refers to race, class, gender, and social conditions, account for between 30 to 55% of health outcomes. In addition, estimates show that the contribution of sectors outside health to population health outcomes exceeds contribution from the health sectors. That's how medical sociology plays in this business, is factored into this business. Okay, then what are some major areas of medical sociology? Used to be this divide between sociology in medicine and sociology of medicine. But the most recent literature shows that actually there are 4 sub-areas in medical sociology. First is what is called social epidemiology, also a field, a very popular field in public health in general. It focuses on the social distribution and social causes of health-related outcomes and behaviors. It emphasizes social structure and material conditions, and that's a main area, sub-area that medical sociologists explores and conduct studies about. The second part is social psychology of health and illness. It focuses on social psychological processes, especially those that mediate. Okay, so keyword is mediate, those factors that mediate and moderate the social causes and social consequences of health-related outcomes and behaviors. Emphasizes the culture and meaning. For example, the study of stress. Okay, so serves as a mediator between some factors studied in social epidemiology, some fundamental distal causes like race, class, and gender, right? And health outcomes, right? Third part is sociology of medicine. It focuses on issues linked with healthcare delivery and healthcare experiences, medical knowledge, and health social movements. Okay. Last but not least is sociology in medicine. That is part that medical doctors and medical researchers are most concerned about, and they want to invite medical sociologists study issues on their behalf, right, or for them. That sub-area focuses on issues within institutions of medicine, including medical treatment, health professions, and the marketing of healthcare, and emphasizes applied research questions like doctor-patient interactions and whether patients follow the advice of doctors and take medication and follow through prescription, etc. Okay, so to summarize, what do medical sociologists study? Well, social causes and patterns of health and disease. So that's epidemiology, right? Social epidemiology. Second is social behavior of healthcare personnel and their patients. Okay. It gets into a little bit doctor-patient interactions and their relationship with patients and patient behavior, illness behavior, or health behavior. Third one is social functions of health organizations and institutions, right? Part of that is related to sociology of medicine. Then is relationship of healthcare delivery systems to other social systems. Okay, again, sociology of medicine. It is an important field of study because it recognizes the critical role social factors play in determining or influencing the health of individuals, groups, and the larger society. In the United States, medical sociology is the third largest section as of now among all sections under American Sociological Association. In Europe, there are a few countries that have separate professional associations of medical sociology. Okay. That shows the importance of medical sociology. So in general, what medical sociology studies, along with social epidemiology, is social determinants of health. So here, what is social determinants of health? What are social determinants of health? And so here, this definition is very information laden, right? The term social determinants of health refers to social practices and conditions, such as lifestyles, living and working and work situations, right? Class, position, stressful circumstances, poverty, economic, political, and religious factors that affect the health of individuals, right? Groups and communities, either positively or negatively, by Cockerham. And let me dissect that definition and do a little bit of anatomy of that definition. So a couple of things, right? First is social practices and conditions, including lifestyles, living and work situations. Second is class position, are related to that construct, including income, education, and occupation. And third one is stress, like life events and stressors. Economic situation, conditions like unemployment, business recession, okay? And political realm, like policies, it could be social policies and health policies and government benefits. Last but not least, like religious factors, including denominations or sect that would discourage or encourage certain medical practices.